Ladies and gentlemen, welcome to PT Pintcast, the Halloween edition, a show that saves physical therapists from missing out on amazing insight, remarkable ideas, and motivational stories in the world of physical therapy. I'm your host, Jimmy McKay. They say the best conversations happen at happy hour. Welcome to ours. Do not forget, subscribe to the show on iTunes, Spotify, and Google Play. Plus, video casting these episodes, if you dare. Online, Twitter, Facebook, YouTube, at PT Pintcast, on the socials. This, a very scary anatomy edition, as we bring in our guest, educator, academic, from Colorado, Mike Pascoe. Welcome to the show.
Hey, Jimmy.
Hello, Mike. This is the first time I'm coming in complete character to an episode. What are your thoughts on my bone structure?
I was going to say you're missing some foramina, but other than that, in general, you're looking pretty good.
What if we went more in depth? What if we went half bone and half muscles of the face?
You know, you're a deep guy, so I'm liking it. It really reflects you well.
Yeah. This is the different visuals that we get to do. I'm a radio guy. We're not used to having all these different things that we can do with the funny cameras and the Snapchat filters.
Wow,
and the
nice.
I had but when we planned this episode, I was like, if we're going to talk anatomy with Mike, we're going to finally get him on the show. It's going to be close to Halloween. And then also I was like, oh my gosh, like Halloween's this weekend. I have no idea how it crept up on us that fast. How did that happen?
Yeah, time and space have completely changed, you could say, lately. So that's how it happened for me.
Things just drag on. All right, Mike, superhero backstory. Let everybody know what you get to do within the profession. And when someone asks, what do you do? How do you answer?
Cool. So, it's usually in the context of a physical therapy discussion, but sometimes it's the occasional person on the street. So I usually say, hey, I'm an anatomy educator, and I work at the medical campus here at the University of Colorado. And I am working with PT students for the majority of their anatomy curriculum. And I get to work with them in year 1 and year 2. We've got a real innovative curriculum. And instead of cramming all anatomy in one 10-week blitz, we spread things out across 2 years. And I'm working with students in lab. And yeah, we have that real neat component to our program as well. So that's what I get to do with PT students. And, you know, I'm not a PT, so I'm just a PhD. I usually work that one in there some way, but I am a PT by association. My wife, Stephanie, is a PT. And so that's kind of how I respond to that question.
Nice. I like that. How do you break that up before we get started? Do you, like when you spread it over 2 years, do you do upper, lower? Like how do you split it?
Yeah, the split is we're going to start with the upper limb and then go on to the thorax and the head and neck. And then because the upper limb really lays a nice pattern for the lower limb, we wrap everything up in year 1 with the lower limb. And so then that leaves in year 2 the abdomen and the pelvis.
All right. So first questions are always the hardest, Mike. What are we drinking?
Oh, gosh. I happened to grab something out of my Breckenridge Brewery sampler pack. And This is called Strawberry Sky. It just happened to be what was coming up next on the top of the box. So cheers.
I like that. Cheers to you. I'm going a little bit something different. I'm doing there's a brown ale from Newburgh Brewing Company, and actually a PT professor out of Sacred Heart University sent me a couple of these like 4-packs, and this was one because I'm local to Newburgh. So thank you to Jay Grimes, Sacred Heart University. So cheers to Mike Pascoe, who is finally on the show.
Got my Colorado beer as well, keeping it local.
Very brown ale. First round brought to you by our friends from Owens Recovery Science. They are a single source for PTs looking for certification and personalized blood flow restriction rehabilitation training and the equipment you need to apply it properly. Pause for a dramatic effect in your clinical practice. Find them online at owensrecoveryscience.com, and they have their new podcast on iTunes where Johnny and the team get to go deep into BFR, the research and the whole nine. It's called the Owens Recovery Science Podcast. We do want to say that there's something coming up. We just had Jay Grimes, who got me the beer, on the show, and they're putting together a Northeast Regional Conference, right? So we're on this virtual world. 4 states in the New England area joining forces to put on their own virtual conference. Might as well, collaborate and bring your strengths together. So it's Connecticut, Massachusetts, New Hampshire, and Rhode Island. And that's going to be on November 7th. We're going to put the link to that conference because you can either watch live or experience live on November 7th. And then the materials are available to you through the end of the year. So that's pretty cool. I will actually be presenting on that, and I'm doing the 11 commandments of communication. Moses doesn't have anything on me because I'm bringing 11 commandments of communication to the presentation. So Northeast Conference will have the link below in the comments as well as the show notes if you want to check that out. All right, Mike, we're talking anatomy, right? It's very apropos for, kind of Halloween. So teaching anatomy, what should people be thinking about? What should students, if they're listening, be preparing for? Because anatomy, no small feat. See what I did there? Anatomy pun right off the bat.
Yeah, to be honest, pretty good one. I would say, if you're getting ready to engage in an anatomy course and an anatomy program in your training, no matter what your healthcare specialty, I think the big picture is you're trying to figure out how the body is organized. When you leave anatomy class and you are with a patient, guess what? Every patient is going to be an exam for you, an anatomy exam, if you will. So you need to leave anatomy with a sense of how the body's organized. So I like to say that in anatomy, in most curricula, it comes first. So I have a real unique perspective. I get to work with what we call the early learner. So they're coming most typically out of undergrad. Sometimes they've done other life experiences, but anyway, they're coming in and they are getting ready for a jolt because they need to take a strong look at their study strategies. So to anybody that's getting ready to dive into an anatomy course, a healthcare profession, you need to take a strong look at what your study strategies look like, because anatomy comes with a lot of baggage, if you will. And that's some of the things that come to mind, Jimmy.
It's the foundation, right? Because everything else after that is going to be, based on this, and you're going to be able to reference that mentally. What are some study strategies? How would you like? How should people organize? I mean, I feel like people teaching anatomy are as different as the day is long. But how would you recommend people organize that? You said they should get ready for a jolt of a lot of information. Right? My anatomy professor, Sky Donovan, did say you kind of come with a cheat sheet because you walk into every anatomy test with a physical representation of the human body with you. So just mentally prepare for, all right, if you peeled the skin back and the muscles, what are you looking at? But what's good study strategies? I did a lot of coloring. Some people are very, very, kind of tactile and use that anatomy coloring book. That helped me sometimes. Some people draw on their body. I did that a little bit in terms of nerves. That helped me visualize that a lot of, Sharpie on the skin there. But what are some things that students or people who want to brush up and get better at this, what can they do to set themselves up for success?
Yeah, it's all about the underpinning strategy. So body painting certainly has a lot of, good literature behind it to support what it's all about. But really, without getting into like individual techniques, let's just make it bigger. And let's say, unfortunately, if you want your anatomy and your learning to be durable, it has to be difficult. So I'm going to tell you that you can't cram anymore like you did in undergrad. Yeah. You cannot read and reread paragraphs in your textbook. You can't rewatch lectures and highlight in your books. Those things are all very passive, and they are not very they're not very difficult. So unfortunately, the term in educational literature is making it stick, right? So you need to have something very challenging. So fortunately, like once you get exposed to those basic principles, then you go to any of your classes and you bring this viewpoint of what am I going to do to make it challenging? So no matter what you're learning, what I like to suggest to students is do the blank page challenge. Okay. So get your learning objectives over here, get a blank document, and can you do on your blank page what the learning objective is asking you to do? If you are rereading your lecture slides or your lecture notes, are you really able to do that? Are you going to retrieve that information when it's an exam or a patient in front of you? So that's like the big thing, Jimmy, that I say is make sure you've got something that's difficult, which goes along with learning is counterintuitive. The more difficult learning is, actually, the more we learn and the more it sticks.
Yeah, when you can put yourself in a similar environment to being tested, which is, oh, this is hard. I got a shot of adrenaline that just shot out in my bloodstream and I'm uncomfortable and here comes the sweats. That's when you know it's difficult, but that's going to simulate the test environment, right? I remember the first anatomy practical we had, and you walked into the room, and everybody had to no talking, and you were going to walk from station to station. That's how we organized it, and that was pretty intimidating, and it was fatiguing. That was one thing that our professor prepared us for, to her credit, but I don't think I realized how fatiguing. Oh man, I don't know. There were like 30 stations and you were standing at each one for 2 minutes or something. That's an hour of standing on that anatomy floor, which could trash your knees and your lower back and everything. But just having the stamina to say, okay, I'm going to go over here and now I've got to reload. Whatever I just think I either made or missed over there at station 5, throw it out. Doesn't matter right now. I'm at station 6. So I think that putting yourself into difficult situations is the best way to do it.
Yeah, sure. Physically and cognitively, for sure. I mean, there's so much we can draw from our colleagues in cognitive neuroscience about what makes learning best, and just that repeated retrieval practice is really important. So for a long time, I always looked at students that made stacks of note cards. I always kind of gave them the side eye because I was always wondering, like, is that really good? Is that really helpful? But it is, if used properly. If you are truly testing what you know without flipping to the back and cheating, that's effective. That's going to stick.
If you can do that, yeah. I had, and I'm sure you've got stories upon stories. Anybody who teaches anatomy sees like funny, weird things that students have done. I had a classmate. She knitted out of yarn the brachial plexus, and that helped her. I looked at it when she brought it into class to show everybody. She was proud. It was a great feat of knitting. It made me immediately sweaty and scared because it looked even more confused. I think it was more confusing than the actual human body, than the cadavers we were working on. But what are, besides note cards and knitting the brachial plexus, what are some different things you've seen students do?
Yeah, I mean, certainly the body painting, the body marking. I've seen students make up dances that will help them remember the dermatomes and the myotomes. So, some very kinesthetic and active individuals there. I've seen paper models. I've seen people doing a lot of drawings. And, the great thing about all of these different modalities is there's a way to kind of bring them all together. And that's what was really one of the benefits of a platform that we were using at the University of Colorado. That's like a wiki page. I don't want to derail us too much, but as you say, students have all these different ways of learning, and it is a tragedy that they don't get shared and disseminated in an easy to find manner. And with technology, like if you can edit a Word document, you can edit a wiki page. Yeah. And so we did have a lot of students contribute their drawings. Every time I get my course evals, which I just went through my summer course evals not too long ago, students really like the drawing exercises. Draw the brachial plexus, summarize the arterial supply of the upper limb. So it's really good to see what kinds of things the students are bringing in. And that's why I love my job, is every cohort of PT students is different. They have different backgrounds, different strategies, different experiences, and different ways of looking at anatomy. And just when I think this is the year that I've heard every way to look at the brachial plexus, a student will show me their notes, and it's a totally new way of looking at it.
Wow. It's kind of cool to see how people, you get 40 students in one room and you show them the exact same thing, and they will come back with 40 completely different views of what you just showed them.
Keeps you on your toes.
I love that. And I had classmates. I was a big app guy. I had the computer. I could just kind of cast my my laptop on the screen, and I loved using like Essential Anatomy and kind of spinning the body, taking away parts, going deep, going external. And I thought that was really, really innovative. I did not like. I still have my Netter and my Moores. I didn't like it. To me, it was overload. I liked how the app, I could take things away and I could not see them. Have you ever seen? It's called The Concise Book of Muscles, and the author's last name is Jarmy. It's really great. It's almost cartoon-like, but I suggested that for all the students the year and 2 years behind me. When they said, listen, the Netter book is like a phone book and it's great, but I was like, honestly, for me, it was like cognitive overload, which you mentioned. And this Jarmy was the author. It was on Amazon, and it was called The Concise Book of Muscles. And for me, it did exactly what I needed to do. Is where's the muscle? Okay, got it in context to some bony landmarks. What's the origin, insertion? What's the action? What's the innervation? Great, I got the blood supply too. Let me move on. But it was more flashcardy for me when I looked at Moore or Netter. I literally started to like get sweaty. I'd have like a physiological reaction. I was like, too much. I'm going to overload. Question from the audience right here. Joe Mountain, no stranger to the show. She wants to know what you think about comparing and contrasting joints: shoulder joint with the hip, knee with the elbow, foot in the hand. This is how it was taught to her, and it really stuck. What do you think about that? Using those things to compare. You mentioned at the top of the show, you guys start with upper quarter, thoracic, neck, and then work your way down.
Exactly. And that is exactly the approach that is taken. So we talk about adaptations. The upper limb is adapted for mobility. We have in the PT world, we have the hand is the focus of the universe. The whole point of all of this is to put the hand in space. That's a very hand-centric model, and I like that. And we go through all of that, and we talk about, well, what's the trade-off? If you have a lot of mobility, you're going to give up on stability. But then things flip when you go down to the lower limb. So that definitely happens. We get to compare and contrast the different types of synovial joints and the different extremities, and that is done. And I'm kind of glad to hear from the listener that helped things solidify and stick for them, because I don't get that direct feedback, but that's the way I do it. So that's reassuring.
Yeah, and you're hearing, as you mentioned, you're hearing every semester is something more different from the students. Katie chiming in, or more PT specific, right? I lucked out that in the semester I was taking anatomy was my first integrated clinical experience. And I want to pat myself on the back, but since this is so mobile, pat, I was working with some of the PT techs who were at that point in their career, taking classes to apply for PT school. And I instituted muscle of the day. And I would bring that concise book of muscles in. I'd photocopy it 10 times, and I would put it on the inside of a cabinet door or on the desk that the techs and the PT students use. And I would just randomly call out, what's the origin and insertion? And whoever answered first, kind of got a point or whatever. Like, all right, what's the action? And you could see people like doing, okay, action. What's it going to be? Yeah, put your finger here, put your finger there, then move it. And that was more, as Katie is saying, more PT specific, which is like, yeah, in a silo, it's really cool that it attaches to the lateral third of whatever. But like, what's it do? Where's it go from? What's it used in? What's it going to be? How can you challenge it? How do you stretch it? Like, how do you so that was, as Katie is saying, more PT specific, which definitely helped with me. And that's why I referenced that concise book of muscles, because I like cartoons and it felt like a real cartoon model for me.
Sure, I'll have to look into that. I'm not familiar with that one. It kind of sounds like the trail guide to the body, which is great for palpation. Yeah, that's got to be on every PT's bookshelf. That's quite good. And yeah, Katie's onto something there with regards to context. Every time I teach at the professional school level and I'm working with the clinical group, they have to be asking themselves, like, why is he talking about lymphatic drainage of the abdomen? Why do I care? So, I do look to Moore's essential clinical anatomy. Being a non-clinician myself, I do look to several good textbooks, a lot of the clinical anatomy journals. I'll see a real interesting, case study. I can bring that in and provide that. There's a lot of resources out there. Radiopedia is great for these things. And yeah, for the PT student to really get engaged and really connect, you have to frame it in a PT practice context.
Yeah, I had a great professor in PT school, and he was from Ireland. So, of course, he just sounded really cool with the accent. And he would always just be like, what? So what? Now what? Like, okay, great, Jimmy, the origin and the insertion and the innervation of this muscle. Like, why? And I was like, but I know all of them. He's like, great. Why? And I'm like, oh, great. Yeah, I'm gonna have to do something with this eventually. It's like, right. So understand that it comes with a reason. So Cadaver Lab, is that what you're using? Because there are some programs who are going to either the syndavers with the synthetic cadavers, and some are having to use applications and computer programs. But in terms of impact with COVID, how have you guys been able to still do that?
It depends on what program we're talking about. So early in the pandemic, pretty much the lab was shut down, and the students that were in the lab in the spring, they had to leave the lab. So then what happened with that second year anatomy course that I mentioned, we were all remote. The course had some changes. We went from a 6-week second year course to a 3-week course and did it all remotely. using other representations of the body. So I was bringing in an app in that case for this case study. And from what I heard from the students, it went pretty well. Again, as I talk about, the big picture is, how is the body put together? How are things organized? And if I'm palpating somebody's arm, do I understand what is where relative to everything else? So I do feel like a lot of these 3D apps do that. And in the same breath, I also say that that is still second tier to actually working with actual human anatomy. And so what happened with the first year anatomy program, we were all remote in June, but then we got back in the lab in July and August. So I had to intentionally think about what are we going to do? What are we going to do in lab when we come back together? And my colleague who I teach anatomy with, David James, made a great suggestion. He said, well, they're PTs, it's an MSK focus. Let's do thorax, head, and neck virtually, and let's do upper and lower limb as dissection in anatomy lab. So the medical students came in and they worked with donors. The physician assistant group, we are taking a different path for many different reasons, and we're remote and we're virtual. So there's a big diversity of answers there, Jimmy, on what people are doing. But the group of anatomy educators in our country has made a real nice guiding document that explains why donor-based anatomy is so critical and essential, because that's what all the schools are doing. They're looking at everything that's done on campus. Is it essential? Can we cut it? So if anatomists want to do anatomy on campus, there is a guiding document out there.
Where can they go to find that? If someone's
You're going to want to look for the American Association for Anatomy. A group of my colleagues put this excellent document together, and it's just a real good position paper that you could hand over to your university administration and say, hey, this is actually recommended as a very high standard. And if you're looking to educate your students the best that you can, here we go. These are reasons why it's safe and how you can do it safely. And that's what we were able to do at the University of Colorado.
Yeah, best practice in action. Mike, you alluded to a student wiki, and I actually participated in, I'd never heard of what a wiki was before I went to PT school, but that professor I just referenced, Jason Craig, cool Irish accent, he put one together called Morphopedics, which is like one of the most accessed, he gets like a gajillion hits a month or whatever, because he went to a conference years ago and they mentioned, here's this thing we can do now in education, wikis, and he made one, and it proved right, because every year he made the students, he picked either a different body region or a different project for everybody to contribute. So he always had 40 people contributing per year. But student wikis, we know Wikipedia, right? And those things are related to wiki. So if you've seen Wikipedia, right, that's the number one wiki. But this is terribly helpful because it's a different way for a lot of contributors to arrange information in different ways. Very helpful.
Absolutely. And the genesis for the wiki at our university was, there was at that time, it was a Google group. Think about like a Facebook group. It's closed, it's private, and all of your classmates are dropping in their Anki flashcards, their drawings. They copied and pasted the learning objectives, and they've answered the learning objectives underneath each one. Great strategy. But what was happening is, as they were sharing these things, it was chronological.
Right.
So where is that awesome drawing of the brachial plexus? And people would spend a lot of time trying to find that stuff. So the wiki has no chronology to it. It's basically a website where you create pages, you add content. Hyperlinking is a big thing. You can embed any videos that you find that are interesting. We saw students doing that. So that was the real genesis of this student wiki. And as you mentioned, with the wiki that you participated in, a lot of volume, a lot of hits, a lot of traffic. Very popular and highly utilized.
Yeah. Different elements for, studying and sharing. You mentioned light field photography. I purposely didn't Google it because I was like, I want Mike to be the first person to explain to me. What is light field photography?
Well, okay. Maybe you probably haven't heard of it by its technical name, planoptic photography. But when you go on Wikipedia and look up light field photography, you'll see planoptic. So basically, these researchers, they have basically found a way to take the light that comes in through the camera, and they break it up into many different vectors or arrays. And the sensor at the back of the camera is capturing not only the visual information, but information on the direction that the light is taking. So Why do we care? What does that do for us? That allows the focal point to be adjusted after the picture's taken. Traditional photography, depending on your subject and, foreground, background, you have to choose what's going to be my focal point. But with planoptic or light field photography, you can change this. And I believe you're actually seeing this technology making its way as predicted into smartphones. I'm not sure if iPhone has this or if any of the Samsung phones have this, but with all the different cameras that are on the back of the phone now, you're able to take your photos on your camera roll and you can change what's in focus. So that's the basic idea of what the technology does for you.
That's pretty cool. Digital dissection guides. What's involved in those? Is that more the apps, the essential anatomies of the world, or?
So don't think about that. Think about the very tedious task of dissecting a human body, right? And you're an educator and you have your students and you have your objectives. How are you going to guide the students in taking the body apart? And so what we found was challenging is we had a third-party generic dissection guide. It's very popular. It's very good. But year after year, there were the same comments from the students. It's unclear. We don't know how far to take this nerve. We don't know how far to take this vein. Where do we cut this? There were just all these little tweaks. And talk about extraneous load. We would say, do pages 9 through 15. Oh, but then on page 7, don't do this. And on page 6, do this, this, and this. I mean, it was just mind-blowing to be in that environment for the first time, let alone following these instructions. So for many years, many anatomists were saying we need to come up with our own custom dissection instructions. And this kind of, rule of specificity, the more specific and tailor-made something is, the better it's going to be. And that's exactly what we found. We put together a dissection guide for the lower extremity, customized it, leveraged these effective learning strategies. So quizzes as you go through for that retrieval practice piece. And the experimental group, they scored 8% higher than the control group did. I mean, that's almost like a full letter grade. Right. That's pretty big in terms of impact on learning outcomes. So that's what we did. We used Apple iBook Author. I'm a bit of a Mac fanboy, so I was, drawn toward that. It's a free platform. And, everything Apple does is very graphical and artistically oriented. So it's real easy to put together. And it's really reassuring because now I can go on to my next region and write that without worrying, is this a waste of my time? Is this a waste of my precious time? So I definitely recommend considering what we found and what we did. Yeah.
My professor of anatomy, Sky Donovan, chiming in right now. She had to write her own manual, study guide, and questions. Very labor intensive, but you bring things full circle, right? I mean, this is when you get an iPhone, when you get a new computer, when you get a program, the computer, the phone actually teaches you how to use the program, the computer, or the phone, right? And that's kind of the world we live in, which is it's showing you how to do it. So it sounds like you were making it easier. You were using those concepts like very Mac oriented, right? I mean, Jobs was famous for like focusing on the font and the typeface and everything in terms of making this as easy to use and as desirable to use. And that's what it seems like you're doing, because this is very tedious. I mean, I was probably one of the worst anatomy students, and I think Sky will probably chime in to agree. I was a little freaked out. I don't know. I mean, I definitely loved when the body was dissected. So I lucked out because I had some great, lab partner classmates. I was fine with that, but it was the doing. I could not separate the doing. How do you separate the doing? I couldn't do it.
Yeah, that's, I mean, I think what we may be thinking about is similar in that we've had these great gains in learning, but I wasn't fully sure if it was the Jobs serif versus sans serif typeface. Was it the quizzes? Was it the more efficient narrative that was given? Or was it the fact that, I mean, one of the things that students are experiencing in the lab is their dissection guide. For one reason or another, the electronic version takes up about 10% of the screen. Okay. It was really weird. It was really awkward. It's HTML. It's from a different era, Web 1.0. And I just could not help myself to think, like, why is this? Because we have giant iMacs in the anatomy lab. Why is that real estate not being taken advantage of? So, one of the limitations of the study was, where exactly did these gains come from?
Yeah, right. Where was the win? Where were the wins from? Yeah. What do you think? What will you do next time to try to figure that out?
Yeah, I mean, I think next time, in order to kind of tease those things out, I think what we're going to need to do is we're going to go on to probably from the lower limb to the upper limb And we're going to need to I really don't know, honestly. I'm trying to think about it here and now as to what we could do to kind of remove some aspect and keep the other. It's really hard to separate the two. So
big
I
deal.
think it's just that specificity principle that this is the objectives for the course. These are the structures that you need to find, because having a checklist, a structure ID list, that is very necessary, because students would be told, here's your list for the class and here's the book. The book is going to ask you to find 10 more things than you need to. You'd walk over to a group and they're looking for one of those nerves. It's like, guys, you don't need to be able to identify that nerve, and that never goes over well. So
yeah,
stay tuned on that. I'll think of something.
Guy chiming in to save me a little bit. She says, I was not the worst. So at least that means there was scientifically was one person at least worse than me. But anatomy is very hard, a learning skill. I mean, you mentioned this earlier, trying to observe, to do, and learn from what you're doing at the same time. It's pretty difficult. It would be great to take anatomy twice. I wouldn't mind doing. I think all of us would be better the second time we do anything. But yeah, I think I would probably gain a lot more from taking anatomy again. So I'll be down in the lab pretty soon. Sky, no pressure. I'll be down there. What other work do you get to do in the field in terms of research?
Let's kind of dovetail off of that comment, because when I do tell, especially PTs, what I do, because I go to CSM every year, and I love chatting with PTs, super friendly and outgoing. And they're always saying, oh, well, that's awesome that you teach anatomy. I loved anatomy. I love my anatomy professor. And I really wish I could get back in the lab. They always say that. It's like a 95% success rate for them saying that. So we do have an opportunity at our university. We do a Marquette Challenge fundraiser where we bring practicing clinicians into the lab. And I just love the event so much because it's totally student-led. And when you give students an opportunity to excel, I mean, they take it and they run with it, and they do something better than I would probably put together. So what they do is they've done, and these are second-year students, they've done a dissection of a donor down to the joint level. That's the benefit of having a second-year anatomy course. Right. You do the abdomen and pelvis, and now with the remaining 3 weeks, you can do a very tedious investigation of the ligaments, the joint capsules, the articular surfaces, all that good stuff. And we always try to maximize the learning effect that the donors have, because that's the mission of the State Anatomical Board, education of healthcare providers. And if we can go beyond the PT dissection course to now a continuing ed course, we're going to do it. And we've been doing it for 5 years now. So the second years come in and volunteer their time on a Saturday, and they take the clinicians through a demonstration of their prosection, of their dissection. So it's very good. We need to probably do some more systematic investigation of what the clinicians actually get out of it. But the comments that they make, they love it. It was great. They got to review some brain anatomy with me, all of the different joints in these different stations. And I mean, just the perspective that you have practicing for 20 to 25 years, you have this mental model of what the lateral ligaments of the ankle look like, right? But then you come back in the lab and you get to see that, touch that, and see what motions are restricted in a pretty artificial environment for sure, but they really enjoy it. And I think it's hugely beneficial.
Love the fact that you're doing it for the Marquette Challenge, which benefits the Foundation for Physical Therapy Research, which, if you want to go full circle, you're doing research to benefit research. I was just added to the board of trustees over there. So I'm excited for you, Mike. Maybe we'll try to, we'll get on the phone with you, try to figure out how we can replicate that, because I know that Marymount University, where Sky taught me anatomy, they make it a fundraiser as well, where they do something very, very similar. She heard the similar comments where clinicians in the DC area were saying, I'd love to get back in the lab, just right this way. She raised money that way. So that's fantastic. What are some of the comments that you hear on the exit? Like, hey, thanks for letting us come in. I learned what, or I picked up, or I forgot, I didn't remember this.
Yeah, I mean, the knee stands out. Getting an appreciation of the knee joint capsule, that is a big hit. That is very complex, how the patella interplays with that, how the menisci interplay, just where things can go wrong with that synovial membrane, right? And where that can, manifest in the knee joint itself. So they talk about that. They really get a hit out of the shoulder. They really like seeing where the tendons are And just, I think the joint capsule really stands out, because I have to say that the joint capsule probably doesn't get a lot of press. It doesn't get a lot of attention when you're in your anatomy course that you are probably in. I mean, and in year one of our course, there's not time to go that deep. So they get to see the joint capsule, and in the shoulder, they really get to, they really say like that shoulder capsule, that inferior aspect, there's nothing there. There's no tendons, there's no ligaments. No wonder that inferior dislocation is the most common direction. So, I mean, you just all these comments about the clinical correlates and how they do talk about, I have a patient that has this going on, and now to be able to see it, I think it makes a lot more sense. Those are the kinds of comments I'm hearing.
Yeah. Reiterating too, is teaching someone else is a fantastic way to teach yourself and remember as a student. And then conversations, much more fun than flashcards. Conversations way better than presentations. That's like kind of the motto of the show. And then have you heard this one? Sky comes in with a hot quote. I forgot about the pectineus.
I forgot. Yeah, the poor pectineus. I haven't heard any clinicians say that as they were leaving, but
they were thinking.
I'll have to listen closely. Yeah, that's a good one.
Favorite part of the body? I mean, I can't ask someone who works in the world of anatomy. You know, what area do you like?
Oh man, I mean, that's like asking, you know, which is my favorite daughter. I mean, come on. I find something fascinating about every region, but just to keep it exciting, I would not have a doctorate degree or my amazing job if I didn't have the first dorsal interosseous muscle. So the hand, I did my dissertation on the activation signal to this little muscle when you do index finger abduction. You study that, 200 times, they'll give you a PhD, right? So I'm very partial to hand anatomy, probably because I'm around these hand therapists and around these PTs who put this as a very hand-centric world. That's why we have all of this.
Right.
And I really like the intricacy. I mean, the dissection, when you can get a lumbrical out, when you can get some of these nerves out, the students are just really amazed when that starts happening. So I love the hand. I love the way hand surgeons explain the movement of the hand. I love the way PTs explain rehab of the hand, all the considerations of the ligaments. I'm better stop because we'll run out of time. I love the hand.
Well, I've got a quiz for you. I didn't prepare you on this, but it's a quiz question. I think you can handle it as someone who teaches anatomy and studied it. What is the largest lateral rotator of the neck? What is the largest rotator of the neck? What muscle is the largest rotator of the neck? What do you think it is?
Oh, man. I mean, my intuition says sternocleidomastoid.
It's actually my gluteus maximus when I walk by a group of girls. Hi-yo! Anybody?
Was that a rim shot? I hope someone hit a rim shot.
Yeah, sorry. I used that as an opening joke at a conference, and it did get laughs there. Research you've done. You talked about the dorsal interosseous that got you the PhD. What other research have you done or are you doing in the world of anatomy? What are you working on?
Yeah, so it's really a wild ride because I was in a neurophysiology research lab, and so I really shifted gears. So I had to really consider, like, what am I going to do? Where do I want to take this? And I was really pleased to find that there is a very vibrant scholarship of teaching and learning community within anatomy. So it's like a double bonus. I get to do research now on the scholarship of teaching and learning, educational pedagogy. And not only do I get kind of credit toward research, and I get to help my colleagues move their teaching forward, but I get to move my own teaching forward. So we've really hit on like the major projects that are going on, the light field photography, the wiki, the digital dissection guide. There's a project going on with chatbots right now. So we were really curious if like the whole concept of a chatbot, like this information concierge, students are going to want basic information when they're doing dissection. Let's bring a Google Assistant into the lab. And so we're working on that one and trying to figure out the best way, because our first idea is often your first iteration was not successful. There was a lot of technical hurdles to getting that set up on students' devices. And the questions they asked really blew our minds. We thought as educators, they would be dissecting and they would want to know what's the attachment, the distal attachment of the brachialis, because their dissection guide says, clear the muscle to its distal attachment. But they were asking questions like, what is the brachialis? I was like, wow, this is really interesting. So we're going to have to revamp and improve in the second round. So that's been a real fun project. And then moving back to clinician training, we have another opportunity to extend the learning opportunity for the donors. So after the donors are used in our anatomy course, we have the respiratory physicians come in, and they are fellows and residents in training, and they are practicing cricothyrotomies. So this is an emergent surgical procedure that many respiratory physicians, they do not regularly perform. You might do one every 10 years, but it can be life-saving. There are situations in respiratory therapy where the airway may become blocked, and to have a surgeon come over and perform the procedure, that's critical time you don't have. So
Right.
that's been a really fun project led by a medical student, Katerina. And basically what she did, she was a TA in anatomy over the summer with the PT students, and she saw the opportunity. So we've run around 12 to 15 clinicians through the training, and to see their responses has been really rewarding. I mean, to know that so I indirectly affect patient care, right? I'm not allowed to touch people. That's one of my taglines. They don't let me touch people. They let me touch whole body donors, but I can't walk in and treat a patient. But I indirectly get to influence people that do. Somebody may perform a life-saving cricothyrotomy because of the opportunity that was given to them in our anatomy lab.
Absolutely. Yeah, that's great. And you're getting the most miles from these donations. And I like how you call them, donors. We had a really great ceremony. We used the labs at George Washington University in DC. We took the metro over there, and that's where we learned. Cool. And they had, I'm sure they have this at most facilities too, most educational facilities too, which is the ceremony afterwards to thank the families and the donors. That was a moment in PT school that I really remember. What sort of things do you guys get to do with that?
Yep. So again, if we want something done pretty amazingly, we hand it to the students and we say, okay, students, you have been most close to these individuals. How do you want to honor them? So it's very interprofessional. You've got all of the professions, all the vice presidents, they all come together. They put together a ceremony, and they invite all the family members of those individuals that have donated in the last year. And so we have musical performances. We have a chaplain say some words. And then we have a representative student speak from every one of the professions. So like a PT student will get up and they will give their reflection and talk about a very needed skill in healthcare, the ability to reflect. And we really nail that in our program and on our campus with interprofessional education, lots of writing assignments. And so the students will share those. And then we turn the microphone over to the family members. Any family member that would like to come up and say some words about their loved one can do that. And many times it's children or a spouse. And you get to complete the picture, because in the lab, you're there to learn anatomy. And of course, we encourage students to express themselves and to ask the questions, who was this person? What did they do? How did they use their body? Were they a farmer? Were they a CPA? Like all these different things, right? So when you see the family members come up, they will talk about what their loved one did. And body donation is anonymous. No matter where you are, it's anonymous. So you don't know, but you kind of get a little piece filled in of your experience of working with a donor when you're like, okay, I wondered what my donor was like. And now somebody that knows them the most is telling me what they were like.
Wow.
It's really powerful.
I thought it would be really powerful for the families. I went because I wanted to respect that, but I got a lot. I mean, I thought I'd be there to, be part of this, just being in the audience. But for me, it really, as you mentioned, when I started hearing the stories about the people, not that I didn't think of them as people and having a past and a family, but when you hear it, I mean, that hits you, that really hits you. You start to picture these people. I mean, now you're seeing their families. I got a ton out of that. That was something, I believe it was optional. I would strongly recommend going.
Yeah, I think, and I'm pleased to see a very large turnout. We pack our 600 seat auditorium. I think pretty much every student is there. It's really powerful. Yeah, it's good.
I wanted to go back and not skip over the fact that you are making the most out of these donations. You mentioned the procedures that they get to try on. A lot of other programs can benefit from these study of cadaver. So you've also got to worry about finances and use them for multiple course, undergrad, graduate. How many different lives? You mentioned Mike doesn't touch patients, but he can touch cadavers and he can teach that way. How many different lives and careers and things can you influence by these donations? And Mike, I'm in the same boat as you. I mean, the first time I did this podcast, I was like, how many different people can you affect? I mean, someone listening to Mike tonight, right now, as I record in my living room and Mike's at his house in Colorado, someone hears something, takes that idea and does something with it that changes someone else's life. And then, it's the butterfly effect. So all these different parts of what we learn and how we're taught, they can go far. Yeah,
it's good. It's a privilege for sure when you frame it that way.
Yeah, I love that. Anything else we didn't get into on this Halloween edition, this anatomy edition of the show? As we,
there was one thing that was really helpful. I think it's very helpful in the era of COVID, and that is when we are forced to restructure our curricula based on these guidelines and these restrictions. It really begs the question. Sometimes cuts need to be made. There's a little pun for you, Jimmy. Cuts need to be made. So content cuts. So what are we going to cut out? And I've got colleagues in medicine that have done amazing studies that ask expert anatomists, okay, all the possible objectives and regions and topics of the body, which ones are need to know and which ones are nice to know and which ones are you kidding me? Don't burden the student with that. So I really like that idea. I did kind of like a survey of the field. Nobody's done that for physical therapy. So that's my current writing project right now, is getting this out the door. I presented posters of this work. You can find that through my website and things like that. But basically, I put together a really big survey with around 40 learning objectives. And I wanted to do something a little bit different than my colleagues did. Instead of what do expert anatomists think? I wanted to ask, what do PTs, PT faculty, and recent graduates think is need to know versus nice to know and not essential? So that went out to like 400 people. It was a pretty wide net that was cast in those three different categories, and like 160, 170 people came back. So a pretty decent response rate. And I had them rate my learning objectives. So now I have a pretty good sense, like, for example, all three categories, faculty, students, recent graduates, they all say that it is essential that a PT student is able to draw and label all peripheral nerves coming from the brachial plexus. Now, when you go to medicine, that's different. That's my challenge, right? What do you teach to what group? Medicine, if you're going orthopedic or neurologic, then you need to know those things. But for MSK experts, movement scientists, you definitely need to have all 16 peripheral nerve branches. So I'm a PhD, as I mentioned. One survey found 50% of anatomists teaching in PT programs are PhDs. They're not clinicians. So in some ways I felt like I was flying blind, but now I have this survey and these data that show me what is need to know. And you know what the best part is? I can have confidence not only in what I am asking the students to be able to do, but every time a student asks me, when do we really need to explain fetal circulation? I know from a very comprehensive, I've got an algorithm to determine the minimal level of support to keep an objective versus to put it to the side. I know that fetal circulation is not something an entry-level DPT needs to be able to explain. So I cut that out of my learning objectives, my recordings, my lectures. I gain time that we can devote to being able to name all those brachial plexus branches.
Yeah. So you're using research to guide your educational practice.
That's what we do.
I like it. All right. We got to have you back. We got to figure out some way to twist this again. I'm sure we can do that. But for now, we've got a tradition on the show. It is called 3 questions. Let's do it.
Okay.
3 questions brought to you by our friends from Arius Medical Staffing. Find them online at AUREUSmedical.com. Leaders in #travel physical therapy. Do what you want to do, where you want to do it. be a great physical therapist, be a great physical therapist assistant, all settings, and again, all 50 states, plus Washington, D.C. First question on 3 questions, Mike, is a where question. You're in Colorado, pretty sweet place to be. Comes up a lot on this question, but say you've got to go out of Colorado. Where in the 50 states are you going to go first once this whole COVID thing lightens up?
I want to take the family back to Gulf Shores, Alabama. The South is quite different for me as a Colorado native, and my wife took me there a couple of years ago, and I loved it. The sandy beach, the water, the kids loved it. We got to get back to Gulf Shores.
I like it. Very smart. Second question is a what question, and I keep it open-ended. But what is something that you've watched or read or listened to, book, movie, podcast, that you think the audience would get value from?
I really enjoyed listening to Digital Minimalism by Cal Newport. He's the guy that wrote Deep Work. And I think we all need to evaluate how we're using technology, especially in pandemic time when we're kind of thrust into technology. So I think digital minimalism was very impactful for me, and I think everyone else would benefit.
That's going on my list because I watched The Social Dilemma and it scared myself.
Oh, I got to check that one out. Yeah.
That one on Netflix was a little scary for me. And I was like, yeah, I'm guilty of this and it ain't good. So it sounds like they're along the same lines. Last question. We like to start and end with people. Who is someone the audience should know more about?
Oh, man.
I keep it open-ended on purpose.
Yeah, very good. Man, what am I going to say about who?
Like who's someone doing?
Can I say themselves? Yeah, I can because you kept it open-ended.
That's a very anatomy professor thing to say, is they should know more about themselves.
You have to reflect. You have to ask yourself questions, what you're doing, why you're doing it. And I have to say this to remind myself, because that's kind of the joke in my marriage, is that I'm an in the moment guy and I'm doing whatever is great right now. And I have been working on what do I want to do in the long term, and you got to know who you are to be able to answer that question. So I'm gonna pull that one on you.
I like that. No one's done it. Palpate yourself regularly, people. All right, that's 3 questions from Aureus Medical Staffing, aureusmedical.com. Find them online and see where your license and your career can take you. Last thing we do on the show is the parting shot. Parting shot brought to you by our friends and colleagues, the Academy of Orthopedic Physical Therapy. Find them online at orthopt.org. Independent study courses. They get down to the nitty-gritty. If you would like to level up your orthopedic game, the Academy of Orthopedic Physical Therapy, not a bad place to do it. If you're thinking about doing the OCS exam, their current concepts of orthopedic physical therapy, I mean, I took a look at it. I almost had a wrist injury just scrolling through their list of references. It was a lot. That's what I'm trying to say is it's comprehensive, people. So go into it with a prepared strategy, something easy to follow, but that you know it'll get you there if you take your time. Current concepts of orthopedic physical therapy is what you want to do. Again, orthopt.org. So, Mike, parting shot, mic drop moment, last chance to lay something on the audience. What do you got for us?
Make learning fun. So I want to show you my Halloween costume.
Oh, man.
I don't think I told you about this, but a couple of years ago, I got a full body Lycra suit and I became Dermatome Man.
Yes.
So
many people out there are loving this right now.
When the time is right, and students need to understand the given area of skin innervated by a spinal nerve, that's when the dermatome suit comes out. And just take my word for it, it does include trigeminal all the way to the coccygeal region, coccygeal spinal nerves. And yeah, these are the things I think that help make learning stick, giving students a real actual representation of what things look like and how things work. And that's my parting shot, Jimmy.
Wow. I'm loving that. I know my former anatomy professor, Sky Donovan, is watching. She came in. Remember Mr. Goodbody?
I had to look that up. I did not know the reference until recently.
It was a PBS show, and he used to walk in with the bodysuit and do the whole thing. But Sky did a similar suit with the muscles, the superficial muscles. So must be an anatomy professor thing with you guys in the Lycra suits. I like that.
Yeah, it's a special breed. Yes,
it's a special breed. Mike, appreciate you coming on talking anatomy with us. We'll have you back on. We'll see how we can bring anatomy back into the conversation here. Love the fact that we were as close to Halloween as we could get, and on the program. So thanks for your time, and this was great.
Yeah, I appreciate it, Jimmy. Cheers.